Hi everyone. Today is the World Hepatitis Day. We are celebrating in memory of Dr. Bloomberg, who is a discoverer of hepatitis B vaccine and at the same time hepatitis B virus. So as you are aware of, today's day is World Hepatitis Day. Why we are celebrating is the prevalence and complications related to hepatitis B and C, such as chronic liver disease and at the same time liver cancers. Risk increases with these dreaded viruses. Even though we know about these viruses since long ago, and preventive and treatment strategies are not yet utilized in the system to eradicate these viruses. That is the reason this year we celebrate World Hepatitis Day, so that we should not wait for testing for hepatitis B and C, and at the same time when you test, when somebody is having disease, you should not wait to treat them, and at the same time to prevent the surrounding people who are close to nearby the infected people, so that we eliminate viral hepatitis such as hepatitis B and C by 2030. And as you know that viral hepatitis is the one of the main leading cause of deaths all over the world. For every 30 seconds one person is dying related to viral hepatitis such as hepatitis B and C. So from this we came to know that these are dreaded viruses which causes so many morbidities and mortality in the world needs to be taken care of by the public. At the same time, the policy makers should think to allocate budget so that we can eradicate these viruses. So I'll just give a brief of viral hepatitis. As you are aware, viral hepatitis occurs secondary to viruses such as hepatitis A, B, C, D, E. As you know that hepatitis A and E viruses are little bit non-complicated, in the sense they don't cause any chronic liver disease in human beings. However, hepatitis B and C are the viruses which can lead to chronic liver cirrhosis. At the same time, they are the reasons for increased risk of liver cancers in human beings. So how these viruses spreads in the body? First thing is hepatitis A and E viruses spread via contaminated food and water, and sometimes rarely from mother to fetus or mother to child. But however, hepatitis B and C spread with the help of contaminated like through blood transfusion. Second thing is unprotected sex. Third is sharing of needles, razors from the infected persons. And fourth thing, mother to child. So like if mother is having hepatitis B and C, there is risk of getting infection to the developing fetus and the child who is coming out. So to prevent these viruses, what to do actually? So as you are aware of hepatitis B and C, so prevention is better than cure of these viruses. So we recommend to check if somebody is having HBsAg positive or hepatitis C positive. We usually check the viral load in them to make sure that they don't have any active virus in the body. But however, if somebody has active virus, we check the level of the amount of viral load in the patients, and at the same time we check for any liver damage such as chronic liver cirrhosis. And if somebody has liver cirrhosis and abnormal liver function test, we usually treat them with antivirals. For hepatitis B, we have drugs such as tenofovir, entecavir, and for hepatitis C, you have long list of medications which such as sofosbuvir and velpatasvir, which can be given for the period of 3 months. However, the problem is not only treating, but preventing the others from getting the infection. So for a public awareness, we usually suggest to avoid sharing of needles, razors, and at the same time uh, take precautions such as protection while having unprotected sex. And third is to prevent mother to child transmission, check for viral load in the mother, and at the same time, if mother having liver related ailments secondary to hepatitis B and C, children should be vaccinated for hepatitis B once he comes out. And for hepatitis C, only thing is if somebody has viral load, so better to get treated for the period of 3 months. So with these strategies, so this year as a part of World Hepatitis Day, we suggest you should not wait for testing. If somebody is negative, you should not wait for vaccination of hepatitis B for prevention of infection. And if somebody is having infection, please meet a gastroenterologist and check for the viral load for hepatitis B and C. If somebody has high viral amount and if he has any liver damage, please treat with antivirals, so we should have a future with elimination of hepatitis B and C. Hope we can achieve it in the future. Thank you.